Welcome to our viewers and well-wisher of the world. The topic of today is hypothyroidism, or it is also called Myxedema. Hypothyroidism, the other name of the disease is underactive thyroid or the low thyroid, or sometimes called hypothyroidosis. The word hypothyroidism is derived from Greek hypo mean reduced, thyreos mean shield, and eidos form. Thyroid is a small butterfly-shaped gland in front of the neck. Here, the thyroid gland in this disease does not produce enough thyroid hormone, so it is called hypothyroidism. Usual onset is less than 16 years of age in the old people, and it is more common in the women than men because the women undergo the stress of pregnancy and their demand of iodine is more, so the gland is not able to produce that much iodine and the thyroxine from the iodine. So that is leading to the condition hypothyroidism. It is also seen dogs, cats, and horses. They also develop hypothyroidism if their gland does not work properly. Symptoms are poor ability to tolerate cold, feeling tired, weight gain, depression, constipation, anxiety, and irritability. So if the patient have these symptoms and signs, one can just have the idea. If you look at this diagram, this is the normal thyroid gland and this is atrophied or the shrunken or the smaller size of the gland. And here if we do see, this is the normal gland and there is a enlarged gland, which enlarged gland is called goiter. But the thing is, if that is shrunken or if that is enlarged, mainly it is functionally less producing the thyroxine, so causing the hypothyroidism. Now, sometimes swelling in front of the neck, as I have told you, that is due to the goiter, and thyroid hormone is basically affect every organ in the body, even every cell of the body is dependent on the thyroxine for its metabolism. Complications are during pregnancy, it can result in cretinism in the baby, and these are the small sized baby at birth, which are called cretins or short heighted people. Causes are iodine deficiency or Hashimoto's thyroiditis, that is the inflammation of the thyroid gland causing the less functioning of thyroid. Diagnostic method, blood test, thyroid stimulating hormone TSH or thyroxine levels are measured to check the hypothyroidism. Differential diagnosis is chronic fatigue syndrome, dementia, depression, heart failure, and prevention is by salt iodization, that is giving iodine to the salt, and treatment is levothyroxine, and frequency is about 0.3 to 0.4% of the population. One have to understand the hypothalamic, pituitary, and thyroid axis. It means that hypothalamus, the higher brain, secretes TRH, which is green here shown, thyrotropin releasing hormone, that is TRH, which produces TSH, which is red here by the pituitary gland. So that hypothalamus act on the anterior pituitary gland, produce the TSH, which is red in color, and that is thyroid stimulating hormone. Now, this thyroid stimulating hormone produces thyroxine by the thyroid, as one can see the blue color of the thyroid gland producing the thyroxine. So thyroxine levels controls the TRH and the TSH produced by the negative feedback process. Negative feedback is if there is excess of that hormone being produced by the thyroid gland. As one can see, the thyroid hormones T3 and T4 are produced. That causes the increased metabolism, growth and development, increased catecholamine effect. But if these hormones are more than normal produced, as one can see this blue, that is called negative feedback, these are just going to check the release of thyroid stimulating hormone and also the TRH from the hypothalamus. If the level is not abnormal, if the level is abnormal, then this negative feedback system works to control the TRH and TSH. So these are ultimately being controlled by T3 and T4. Here again one can see the thyroid feedback loop. As one can see the various signals, stress, old age, pregnancy and other, that just put the stress or pressure on the hypothalamus, and hypothalamus is going to produce TRH, and this TRH is going to affect the pituitary gland, and this pituitary gland is going to produce more the TSH, and DSH ultimately produce the thyroid hormone T3 and T4, which is affecting on the body organs, increased metabolism, growth and development, increased catecholamine effect I have alluded to. Now, this thyroid hormone T3 or T4, if they are produced more, as one can see by the negative feedback system, it is going to affect first the pituitary gland, and even that is going to affect the hypothalamus to check and control the release of TRH and TSH. So that is feedback loop. Now, epidemiology. Worldwide, about 1 billion people are iodine deficient. Reason unknown. How often it results in hypothyroidism. Western countries with sufficient dietary iodine, they are having the prevalence of 0.3 to 0.4 of the population, and they have overt or visible hypothyroidism. Subclinical hypothyroidism, it is a milder form of hypothyroidism with the normal thyroxine level and elevated TSH level, that is usually above 10 ml, 10 international unit per liter mark, and it occurs in 4.3 to 8.5% of the people, 2% of the children, as their demand in development that is more, so that is being overwork have to be done by the thyroid, so that is going to produce subclinical hypothyroidism. In adults, in elderly and in Caucasian, there is the subclinical hypothyroidism prevalence is there. Children with the subclinical hypothyroidism often become normal, and some develop overt or the visible hypothyroidism. It is checked by the antibody and the TSH level, presence of the celiac disease and presence of the goiter. They people are the more prone to have this subclinical hypothyroidism. Hypothyroidism is more common in women with TSH level above 10 micro unit per liter, and that is also, I have told you, because of the stress of the pregnancy and the menstrual stress and other stresses on the female. They are having the less feed and nutrition as compared to the male. People over 60 years are affected more, and hypothyroidism is more in Down syndrome and Turner syndrome. It is sometimes very severe hypothyroidism and a myxedema, occurs in the woman over 60 years of age. That is one of the severe form of the hypothyroidism, which is called myxedema, Most hypothyroidism is primary in nature, that is the defect usually in the thyroid gland itself. Central mean from the hypothalamus or secondary from the pituitary. Hypothyroidism are usually rare. Now, history of the hypothyroidism. In 1811, Bernard Cortius discovered iodine present in the seaweed, and iodine intake was linked with the gutter size in 1820 by Jean-Francois Condet. Gaspard Adolphe Chatin in 1852 proved endemic gutter was due to the less iodine intake. In 1896, Eugen Baumann found iodine in the thyroid tissue. Myxedema were recognized in 1880 in people of thyroidectomy, those who have lost their thyroid gland and no iodine is there, so they people do develop myxedema. In 19th century, thyroidectomy animals improved with transplant of the plantation of the animal thyroid tissue that was being put in those animals. They were able to produce thyroxine again. Purified thyroxine was introduced in 1914 and synthetic thyroxine in 1930. Liothyronine was identified in 1952. So here are the scientists, those who have done the discovery of the iodine element by the Bernard Cortius, and Gaspard Adolphe Chatin was also the pioneer in identifying this disease. Now, the other animals are also prone to have this hypothyroidism. Dogs are known to develop hypothyroidism, as are the cats and horses. In dogs, majority cases are of primary hypothyroidism. I told you that is of thyroid gland itself, which are of two types: lymphocytic thyroiditis, which is immune-derived cause, and idiopathic atrophy. In cats, cause is medical treatment such as surgery or the radiation done to the cats. In young horses, congenital hypothyroidism seen linked with the mother's diet, the horse. There is lethargy, cold intolerance, exercise intolerance, and the weight gain in the animals. Diagnosis is by the blood test, and treatment is thyroid hormone replacement. Here one can see the dogs affected by the hypothyroidism, cats, and the horses which are affected by it. Now, there are certain risk factors, and anyone can develop hypothyroidism, and one is at increased risk if one is woman, people older than 60 years of age, family history of the thyroid disease is positive, any autoimmune disease like type 1 or type 2 diabetes, celiac disease, Turner syndrome, Sjogren syndrome, pernicious anemia, lupus, and rheumatoid arthritis. They are at more risk. People treated with radioactive iodine or antithyroid medication, and those who have received radiation to the neck or the upper chest, so that is going to have effect on the thyroid, which is in front of the neck. Those who have had thyroid surgery like partial thyroidectomy, or women, those who are pregnant or delivered a baby within past 6 months, as I have told you, the pregnancy, the stress, where there is increased demand of this hormone. Now, risk factors are growing age, the demand is more; pregnancy, demand is more; female gender, stress is more; thyroid surgery, thyroid has been removed; family history, and the certain anti-thyroid medication. These are all the notorious. Now, once you stop learning, you start dying. That is the saying of the Albert Einstein. Whatever the knowledge you have got, it is not absolute. You still need to have more knowledge. So do continue learning. Otherwise, you will be considered as dead man. Now, signs and the symptoms of the disease. Sometimes there are no symptoms or the mild symptoms. Numerous symptoms and the signs are seen, and these are related to the underlying cause. Direct effect due to the lack of the thyroid hormone is there. Hashimoto's thyroiditis present with mass effect of a goiter, and that is the enlarged thyroid gland. I have told you the large size is not sufficient, but it should be functionally good to give proper thyroxine. In middle-aged women, symptoms may be mistaken for the menopause. So the symptoms as a whole are fatigue, muscle aches and weakness without any proper known reason, muscle tenderness and stiffness, weight gain with poor appetite, and person do not take much food but still getting the weight. Feeling cold, poor ability to tolerate cold as compared to the hot season. Slow heart rate, swelling in front of the neck due to the goiter, and patient is having constipation and dyspepsia. In females, initially heavy menstrual periods, later there are light menstrual periods, shortness of breath because of the slow heart rate also, hoarse voice, abnormal sensation, poor hearing, poor memory and the concentration, and the depression. These are the symptoms which are usually seen in hypothyroidism. As one can see, the puffy eyes, the goiter in the neck, and the unnecessary fatigue, swollen ankles, hair loss, and dry skin. One can see the hair dry, coarse, and all these things are just the face which is very peculiar to say that it is hypothyroidism. Now, the symptoms of the hypothyroidism, I already told you, these are depression, forgetfulness, dry coarse hair, puffy face, enlarged thyroid, slow heartbeat, weight gain without proper appetite, constipation, heavy menstrual period, infertility, loss of the eyebrow hairs and the dry skin, and there is arthritis, joint pain, and the brittle nails. So one can go for that. Now, the signs of the hypothyroidism, there is dry coarse skin, cool extremities, myxedema, mucopolysaccharide deposits in the skin, hair loss, thinning of the hair, slow pulse rate, delayed relaxation of the ankle jerk and reflex. Ankle jerk reflex is a characteristic sign, and that is giving the positive diagnosis. Carpal tunnel syndrome, goiter and lower thyroid gland, pericardial effusion, pleural effusion, ascites, that is the collection of the pus in the cavities, elevated blood cholesterol level, swelling of the limbs, pain, stiffness, or the swelling of the joints, arthritis, already I have told you. Now, here one can see the signs of obesity, hair loss, menstrual changes, intolerance to the cold, slow heartbeat, fatigue, depression, constipation, and the joint pain. These are hypothyroidism. Here one can see the limbs of the hypothyroid person, and there one can see the fat, the typical shape of the feet, legs, and hair loss as one can see in the hairbrush, and there is female patron wellness, and there is the depression, and that is the ankle jerk that is going to be giving the definite positive result if there is slow ankle jerk. Now, again, one can see the sign and symptom of that is psychological. I have told you, poor memory and concentration, poor hearing, pharynx, hoarseness of voice, heart, slow heart rate, pericardial vision, muscular delayed ankle reflex, and extremities. One can see the coldness, carpal tunnel syndrome, general fatigue, feeling cold, weight gain with poor appetite, hair loss, lungs, shortness of breath, pleural effusion in the fluid in the cavities, skin, that is paresthesia, myxedema, and there is in case of GAT or intestine, there is ascites or the constipation, and reproductive system, there is menorrhagia. These are all sign and symptom I have already told you in the previous slides. Now, myxedema, it is a rare but life-threatening state of the extreme hypothyroidism. It is seen only in already established cases of the hypothyroidism developing another acute illness, not appear as a primary cause. It may be first presentation of the hypothyroidism. Patient is not aware of the hypothyroidism and that present with the myxedema, Patient is having expressionless face, puffiness around the eyes, pallor, swelling of the arm, legs and ascites, feeling cold or low body temperature without a shivering, confusion, a slow heart rate and dyspnea, physical signs like skin changes or the enlargement of the tongue, that all give you the clue that the patient may be having the myxedema, and the patient is very serious in the ICU, and one can see the puffiness and the feet and the legs of the patient, and also the slow heart rate as one can see from the ECG. So all these things are just giving a clue towards the myxedema, and that is severe hypothyroidism resulting it, and there are the different feature I have already told you, and the precipitating factors are the infection, cold exposure, stroke. There are certain medicines like amiodarone and lithium, and laboratory findings are the hypoglycemia, hyponatremia, hypoxemia, hypocapnia, prolonged QT, low voltage pericardial effusion. I have already shown you, and management is supportive, airway rewarming, hydrocortisone, levothyroxine, and that is a medical emergency and it should be treated like that. Now, pregnancy and hypothyroidism. Even mild or subclinical hypothyroidism lead to the infertility and the miscarriage in the pregnancy. Hypothyroidism in early pregnancy may cause the increased risk of the preeclampsia and offspring with the lower intelligence, and the risk of the infant death around time of the birth is more in these women. Offspring is with lower intelligence and the risk of the infant death around time of the birth is also there, and women are affected by hypothyroidism in 0.3 to 0.5% of the pregnancies. They are prone to have this problem. Subclinical hypothyroidism during the pregnancy lead to the gestational diabetes, low birth weight, and premature birth. Now, hypothyroidism in children, newborn children may have normal birth weight and the height, but the head is larger than the expected and the posterior fontanella is open. Some have drowsiness, decreased muscle tone, a hoarse sounding cry, feeding difficulties, constipation, and enlarged tongue. Umbilical hernia is there, dry skin, a decreased body temperature, and the jaundice is there. The goiter is rare if thyroid gland not produce functioning thyroid hormone or the children living in iodine deficient area. Now, hypothyroidism in children, normal growth and development delayed, no treatment, intellectual impairment occurs, that is, IQ level is from 6 to 15. There is difficulty in fine motor skills and the coordination, reduced muscle tone, squinting is there. In older children, symptoms as those seen in the adult with hypothyroidism, related disorders like major psychiatric disorders including bipolar disorder is there, mood disorder and schizophrenia spectrum disorder are also seen. Now, the hypothyroidism in infants, untreated cases of hypothyroidism during pregnancy that can lead to delays in the growth and the intellectual development in the baby, or the congenital iodine deficiency syndrome, yellowing of the skin and the whites of the eye, jaundice is there, a large protruding tongue is there, and difficulty breathing and the hoarse cry.